Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dr. Muhammad Sani Menage is my name. I'm a consultant otolaryngologist, head and neck surgeon. We've presented a number of series of talks regarding coronavirus disease, and we've received some comments and questions from particularly from healthcare workers, where they say we've introduced in the past that the diagnostic criteria for COVID-19 disease for now remains real-time polymerase chain reaction, which the test kits are now available in many developing countries. What are other things that one can use? So we thought of adding this video where people could have an insight on what they call COVID-19 rapid test. So COVID-19 rapid test qualitatively detects immunoglobulin G and immunoglobulin M antibodies to severe acute respiratory coronavirus 2 in human blood, serum, and plasma sample. So this is one very useful test which is done from the blood or serum or plasma, and which is widely available in most laboratories across developing countries. So this test applies to a lateral flow immunochromatography, and it's a tool to assist in the diagnosis of SARS-CoV-2 infection, especially looking at the fact that some people that need to be tested or that want to be tested do not have the classical symptoms of fever, cough, and difficulty breathing, and they didn't have the exposure history. And one of the strategies currently advocated is get as much people tested as possible. So that is when you can actually try to curtail the spread of the disease by asymptomatic people. So, like we said, the immunoglobulin M and G combined assay has better utility and sensitivity compared with single immunoglobulin M or IgG alone. So, IgG or IgM, each one of them can be used individually. Raising high titer of this signifies some kind of viral infection, but is not specific. But the specificity increases when you combine IgM and IgG together. Excuse me. So, but this can be used for a rapid screening of SARS-CoV-2 carriers. That has also been shown to be useful in people who are asymptomatic or asymptomatic in hospitals and clinic and test laboratories, particularly people that are involved in giving daily care of these patients. So hopefully this adds to the armamentarium of tests that can be used to screen people. So initially, because of its capital intensive getting those test kits, and then there are issues about sensitivity and specificity. So for the sake of screening, people or individuals suspected or people who want to have the test can initially go through the screening by IgG and IgM levels. Then for those ones that have high titers can be subjected to real-time PCR test. Thank you so much. I hope this might add some light to how the healthcare workers are able to diagnose COVID-19 disease. Thank you so much for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.